Welcome to the CS306 Group 8 project presentation. My name is Berenay. My group friends Barış, Ozan, Sena, and Aybars, and I will be the one who present. Our project was on healthcare expenses of countries and their consequences. To begin, let's address the question of which dataset we selected and why. Our project relies on multiple datasets that provide comprehensive information on various aspects of air pollution, mental disorder, population, cancer deaths, and total healthcare. And we carefully created these data sets from our world in data to ensure the accuracy and relevance of the information we analyze. First one is air pollution data set that helped us to explore the impact of air pollution on health, specifically the connection between air pollution and the death rates of different types of cancer. This data also allows us to examine the relationship between air pollution and mental disorder rates. Second one, mental health dataset provides insights into different mental health conditions such as drug use, anxiety, alcohol consumption, and depression. By analyzing this data, we can examine the connection between mental health and other factors such as urbanization and air pollution. Urbanization datasets helped us to capture the distribution of the population into urban and rural regions, which helps us understand the relationship between urbanization and health outcomes. Cancer dataset allows us to investigate the relationship between healthcare spending and different types of expenses and cancer outcomes. Healthcare expenses dataset tracks the percentage of GDP that countries spend on healthcare, allowing us to explore the impact of healthcare spending on various health concerns. Now we can dive into the ER diagram that forms the foundation of our database. The ER diagram represents the logical structure of our database, illustrating the relationship between different entities and their attributes. At the center of our diagram is the country entity, which serves as a strong entity and acts as a reference point for other entities. We have several weak entities connected to the country entity, including healthcare expenses, population, mental disorders, cancer deaths, and air pollution deaths. Each of these entities plays a crucial role in our analysis, providing essential data points for our research questions. Now let's shift our focus to the charts that visually represents the data and make it easier to comprehend and interpret. The scatter map here shows the relationship between cancer deaths and the percentage of GDP spent on healthcare across multiple years and countries. The visual indicates a correlation where countries in Asia with low GDP spending have high cancer death rates. However, a more intriguing finding emerges when focusing on specific regions in Africa. Higher GDP spending is associated with lower cancer deaths. And the same correlation can be observed in South Africa, despite different values compared to Africa. Line chart investigates the relationship between mental disorders and healthcare expenses percentages across 15 countries, with healthcare expenses between 10 to 20% of GDP. The results suggest no significant relationship between mental disorders and healthcare expenses, but reveal a strong correlation between different types of mental disorders, particularly in terms of drug and alcohol use. Bar charts. High depression countries bar chart reveals that approximately 52.5% of the population in these countries experiences depression, based on the average depression percentages between 2010 and 2019. Moreover, a noticeable correlation can be observed between the depression percentage and urbanization rates, as more than half of the countries with high depression rates also have urban populations exceeding 50% of the total population, indicating a potential connection between urbanization and depression. The pie chart provides a breakdown of air pollution-related deaths in urban areas, highlighting the proportion of fatalities caused by poor air quality. And the scatter plot illustrates the correlation between air pollution death rate and urban population percentage in different countries. By analyzing population distribution and air pollution-related deaths through pie charts, it becomes evident that countries with higher urbanization experience higher death rates, indicating a relationship between these variables. I will thank you all for listening. I hope that our presentation has shed light on the significance of understanding the relationship between healthcare expenses and their consequences. Thank you.